It has been shown that quite naturally resistance to novel agents such as BTK inhibitors or BA3 mimetics can be mediated by mutations in the targets of these agents, such as BTK mutations or BCL2 mutations. This is something that is, would say, intuitive and related to the mechanism of binding of these drugs to the target proteins. But it has been also shown that there are alternative mechanisms that might not involve mutations in proteins that are targeted by these drugs. It might be mutations downstream, such as the PLC gamma mutations. Or there is also a possibility that there are non-mutational, non-genetic adaptation mechanisms to both of these drugs. In case of BCL2 inhibitors, it has been suggested that upregulation of other anti-apoptotic BCL2 family members might provide resistance.